Weekend Prime, welcome back. We'll continue updating you now. Let's shift gears to matters health. At least 10 women die daily due to excessive bleeding after childbirth in Kenya. This condition, also known as postpartum hemorrhage, is a major cause of maternal mortality and morbidity world over. On this episode of Health Digest, Gloria Milimu interrogates this lurking risk for all pregnant mothers and what interventions are necessary to ensure better maternal health outcomes in the country.
The events of 2009 that almost saw Eunice Atsali, a resident of Nairobi, lose her life after bringing forth another life, still remains a stark reminder of the lurking risk pregnant women face in their motherhood journey. A planned delivery that took a drastic turn saw her develop severe bleeding after giving birth.
Felt very, abdominal pain. Then I felt like I was in water. So when she opened the sheets like this, blood poured down on the floor and it wasn't clotting.
It was clear that Atsali, who is a midwife by profession, had developed postpartum hemorrhage, which is the leading cause of maternal mortality worldwide. The World Health Organization defines the excessive bleeding as a blood loss of 500 milliliters or more within 24 hours of birth.
It was a very, frightening experience because at the moment, you are wondering what next because you're bleeding. Bleeding is not stopping, and they are trying all the maneuvers.
It was imperative for doctors to stop the bleeding in order to save her life. Many women like her are said to be at risk of developing this condition after childbirth, as explained by Dr. Simon Kigondu, who is an obstetrician gynecologist.
When the uterus, the placenta, for instance, separates, there is that surface area behind in the uterus that has a lot of blood vessels that have been supporting the baby. When after delivery, ideally, the uterus is supposed to contract so as to almost close out those taps, those blood vessels that are there, that you do not get excessive bleeding.
This excessive bleeding can be caused by several factors like failure of the uterus to contract after giving birth, just like was in Atsali's case. Other contributing factors to this include vaginal tears, retention of conception products, and other blood-related disorders, among other causes.
You can get tears of the cervix, and a lateral cervical tear is very dangerous because the uterine artery passes along the lateral aspect of the uterus, and therefore if a tear there goes, it can nick the left or right uterine artery, and a lot of bleeding occurs.
In Kenya, postpartum hemorrhage affects a significant number of women. It is the leading cause of maternal mortality. Kenya ranks fourth in Africa with the highest maternal mortality rate. A United States Agency for International Development report indicates that the country records 594 deaths per 100,000 live births, leaving it still off target of the UN Sustainable Development Goal that aims to reduce the global maternal mortality ratio to less than 70 per 100,000 live births by 2030.
Almost 5,000 women every year lose their lives in regards to maternal mortality when it comes to postpartum hemorrhage. On average, that comes to almost 10 women every other day.
Maternal mortality, according to experts, also has far-reaching consequences on a baby's health. A baby born to a mother who dies after childbirth is said to be 35 times more likely to die before reaching 6 months, according to experts. Therefore, treatment response to counter excessive bleeding is critical for the survival of both mother and child.
One of the major treatments of PPH is replacement of blood and blood products. And that's why the regional blood transfusion units need to be functional. Other measures that you need to do to prevent postpartum, you empty the bladder, because when the bladder is full, it keeps the uterus boggy, so to speak, and therefore bleeding.
Kenya has adopted a cluster of interventions geared towards curbing excessive bleeding. One of such is the WHO recommended treatment response known as Emotive Bundle. This includes medicines to contract the womb and stop bleeding, uterine massage, administration of intravenous fluids, examination, and referral for further care. Most facilities also use a calibrated blood collection drip that helps to accurately measure blood loss. Capacity building for healthcare providers is also recommended to help counter maternal mortalities caused by excessive bleeding.
They say that for every 3 mothers in labor, you need 1 nurse. But a lot of our public facilities, for instance, you have 3 nurses for 150 patients. So already that's a policy issue.
We are establishing what is called maternal newborn health learning hubs within facilities. The training is very skills-based, it's very practical, and the healthcare workers then go to the wards and see actual practice.
Policies that strengthen the supply chain in order to ensure availability of drugs and equipment to help address postpartum hemorrhage is among key recommendations by experts to help Kenya meet the UN target with regards to maternal mortality rate. Gloria Milimu, KTN.